All right, so in this video we are going to look at the nerves in the cranial portion of the cat. All right, so from diaphragm up to head. These are the nerves of importance, the nerves that will be on the exam. So I'm going to scoot my cat a little bit further. There we go. You can see right here, you can see the point of the elbow. So the first nerve, kind of my easy mark, if you will, landmark here that I want to point to is the ulnar nerve. So you can see that one. It comes right in line with the point of the elbow. This is the ulnar nerve. My next landmark nerve that I want you to look at, if we pull these vessels and nerves to the side, you can see it inserting right here into your triceps muscle. This is your radial nerve. Okay, so you've got your ulnar, you've got your radial. Now between the ulnar and the radial is your median nerve. He is in the middle, if you will, of the ulnar and the radial. Now, in this particular specimen, this nerve should have been extending out right here. This is your medial cutaneous. Please do not get the medial cutaneous confused with the median. The medial cutaneous, how you know him, is he will be attached. He may be pulled this way, he may be pulled this way, but he will be attached to a superficial muscle. And if we still had the skin on this cat, you could appreciate that he would continue on and branch into the skin. So, median, pull him over to the side, radial, you can see him diving in there, okay, median, ulnar, medial cutaneous. All right, so now moving towards the head here in my brachial plexus, I can appreciate this really cute little nerve here diving in to the muscle. This is your musculocutaneous nerve. I'm going to take my musculocutaneous nerve and I'm going to pull him over to the side. And then I think if I pull him over to the side, you can appreciate, hopefully, this really nice, fat, thick nerve that is diving in right here into almost what looks like your shoulder joint, okay? This is your axillary nerve, all right? Now, once you've found your musculocutaneous and your axillary, then you're going to move those out of the way, and you will see your subscapulars, and you've got 3. 1, 2, 3. You can count them. You can see them all right there. And then the next nerve that you want to notice, this nerve right here, coming out of your C6 spinal segment, is your suprascapular nerve. All right, this is your suprascapular. Think super on top of. So he jumps up over and goes over the glenoid. Now, let's move on back the thoracic cavity, and I want you guys to appreciate these really fine little nerves here. This particular cat only has a couple left. They are diving out from between the ribs. Therefore, these are your intercostal nerves. And then this next nerve that I want you to appreciate runs down the side, if you can see that, runs down the side of the thoracic cavity. This is the long thoracic. I think in your notes I actually put lateral thoracic because that's what I think of him by, because he runs laterally down the side of the animal. All right. Now, let's move on back up into the cervical region. Just like we had intercostals down here, we have cervical spinal segments that you can see. So these are our cervical nerves. In the cat, I'm not going to actually make you number the cervical nerves, but I want you to be able to appreciate them. All right. Now, as we come on up, we need to take a look at the cranial nerves that dive out that we can see. So the first cranial nerve that comes out of the bottom of the skull right here and comes up, goes to the bottom of the tongue, is hypoglossal, which makes sense because hypo is below, glossus is tongue. Then the next one that I want you to appreciate is this real big old fat pretty one sitting here next to the carotid artery, and that is the vagus nerve. All right, and then the third one, which is cranial nerve 10. The third one that we want to appreciate is going to be the spinal accessory, or just in your textbook says accessory nerve. Your spinal accessory or accessory nerve dives right out of the same region as your hypoglossal, and he comes out and he runs down and he helps some of your spinal nerves. And you can see him right here underneath my veins, some of the branches of my jugular. You can appreciate the spinal accessory right here. All right, so vagus, hypoglossal, spinal accessory. All right, that's all the nerves that are going to be important and vital for you for this section of the cat.